Thank you, Mr. Chair, and thank you to our witnesses for being here today. You know, for some kids, school is the only place that they can get a nutritious meal. And in 2023, the USDA found that 7.2 million children were at risk of not getting enough food to meet their nutrition needs. And not everyone may believe that it's enough food or enough calories, but there are plenty of kids in this country who are not getting enough food and the right kind of calories. And for those children, programs like SNAP and TFAP, the Emergency Food Assistance Program, which supports, among other things, the ability for food banks and schools to buy fresh produce from local farmers, and school lunch and breakfast programs, they're a lifeline. They're meaningful nutrition for kids so they don't fall asleep in class, so that they can learn, so that they can grow and be healthy. And as the USDA's Food and Nutrition Services notes on its own website, there are clear associations between food insecurity and poor health, links to chronic disease and diabetes and cancer. Dr. Studi, what does USDA's research say about the impact of poor nutrition on children's health and well-being?
As noted, poor nutrition has immediate impacts on health. We have evidence around performance in school, but now as we both noted in our remarks, it's extremely concerning that we have such a high prevalence of overweight and obesity, as well as something that's been more recently seen in the literature is that these various factors, poor diet being one of them, low physical activity, and other factors, have resulted in about 1 in 3 adolescents having prediabetes. That statistic, I think, is extremely alarming. So yes, we definitely see that link.
Thank you. And what are the long-term effects of physical health, cognitive development, and academic performance of poor nutrition? So you mentioned immediate results, but long-term, what do we see from these kids who don't have healthy food to eat?
It sets a stage for poor health throughout the lifespan. So it's immediate impacts, but also impacts later in life.
Mm-hmm. The SNAP cuts included in President Trump's big, ugly bill could result in as many as 9 billion fewer meals for families, for children. The SNAP cuts are making a huge impact on vulnerable populations, gutting food assistance. Based on what you've just shared with us, I think it's fair to say that H.R. 1, the cuts in that bill will have a detrimental impact on children, not just right now in the immediate, but for years to come. Long-term chronic health impacts that will plague our society. Dr. Fink, since the Big Ugly Bill passed, community members I've met with have warned that fewer Americans qualifying for SNAP and Medicaid will lead to fewer schools offering universal free lunches in low-income areas, reducing children's access to essential nutrition. As a pediatrician, is it important for children to have regular access to nutritious food?
Thank you, Congresswoman, for that question. As an endocrinologist and as a pediatrician, I can definitely say that having good, healthy nutrition is the cornerstone of developing the best health you have for your future.
Thank you.
And that is why.
Thank you, Dr. Fink. So it's safe to say that losing access to consistent and nutritious meals would be harmful to a child's health?
Well, what I would like to say is we're actually looking to totally reform these programs because right now, the N in SNAP stands for nutrition.
But Dr. Fink, what we're seeing is a cut of funding available for nutritious meals for kids in schools, meals that are often the only available nutritious meal for children from some low-income families. Do you see increased anxiety, depression, or behavioral issues in children struggling with hunger?
Food most definitely impacts all aspects of health, and that is why, in collaboration with the USDA and HHS, we are updating the dietary guidelines because, as you can imagine, the dietary guidelines provide all of the information that then schools use to make these decisions for what goes into these
Yes,
meals.
thank you. But in the meantime, we're cutting significant funding to SNAP for actual food assistance to children and their families. Do you agree that losing access to consistent and nutritious meals due to cuts in programs like SNAP and TFAP under the Big Ugly Bill will be harmful to a child's health, while recognizing that any of your work to plan and reevaluate is not immediate, but that's forward-looking? So do you agree that losing access to consistent and nutritious meals would be harmful to a child's health?
Right now, we are working in the immediate in terms of getting access
no.
to better health for all of America's children. And so
So if a child, say, relies on breakfast after the bell, they get their meals, healthy meals at school, and they are not able to access those meals, that child is hungry. Would you agree that that is detrimental to that child's health?
we are ensuring that schools have the support they need so that they can give the best nutrition to all of
Thank you for not
America's
answering my
children.
question.